Okay, so I'm going to focus on strokes for a quick second. So my mom had a TIA at the beginning of this disease, like in 2015, which people call like a mini stroke. And obviously, you've done a lot of research here. I'm curious, and for sharing with the folks listening, can you talk about the connections between strokes and dementia?
So, dementia is defined as an inability to care for oneself due to cognitive deficits.
Mhm.
And those different domains include like executive, like planning, organizing, bathing, cooking, cleaning, driving, etc. So, that's the clinical definition of dementia. And then within dementia, you have what are the causes? And
Mhm.
one of the major causes is Alzheimer's disease, which is due to abnormal protein buildup in the brain. Then
Mhm.
you have a second cause that at times can overlap with Alzheimer's is vascular dementia. And
Mhm.
that entails any disease that affects the blood vessels in the brain that can lead to deterioration of blood vessels. So things like high blood pressure, diabetes, recurrent strokes, all
Mhm.
that takes a toll on the blood vessels that can down the road lead to cognitive dysfunction. So that's the connection between like strokes, TIAs, and all these other vascular risk factors and how they can lead to vascular dementia down the life continuum.
You talked about you have a goal of reducing stroke disparities. Can you talk more about what do you see in your work and what led you to wanting to say, like, I want to reduce racial stroke disparities?
So I see that there is access to care. Like African Americans have higher rates of strokes, and that down the road leads to vascular dementia. So if we can prevent the strokes from happening in the first place, then we can prevent the downstream
Mm.
aftermath of vascular dementia. So, and this applies to unfortunately multiple diseases across the medical spectrum.
Mhm.
Black individuals have poor access to care. When we do get care, the care is subpar. We face discrimination, racism. We get our symptoms are downplayed. We don't get the access that we need. That at times the diagnosis is delayed because of all these structural racism. When we do get diagnosed, we don't get the same treatments. We don't get offered the same treatments. When we leave the hospital, we don't get the same access to the treatments we need,
Mhm.
follow up. So it's like the entire course of the interaction with the healthcare system is what leads to the disparities in
Mhm.
multiple medical conditions, including stroke and Alzheimer's disease and vascular
Mhm.
dementia.
Mhm.
So for me, I'm looking around and I'm like, well, no one is talking about these issues. I'm a Black female. This affects me. This affects my loved ones, my friends, family, my community. I'm gonna take on this role and do this work. And
Mhm.
that's some of the papers that led into trying to tease out where are we now and what do we need to do to get to where we need to be.
So given all that, you've like touched all my talking points. I'm going to ask a question. So given all of that, I think sometimes, or what I've noticed, people are like, and Black people need to do X, right? Because this is your
Mm,
reality. You community people need to do these things. But I'm going to ask
mm.
you first, given all that you have seen and know and have researched and obviously have experience as a Black woman yourself, what, if you had to boil it down, what would you say are the greatest things that need to shift within our
Mm.
healthcare systems, particularly when we think about patients coming in with forms of dementia?
That's a great question. I think we need to, some parts of healthcare need to be overhauled
Yeah.
because right now, the way healthcare is practiced on what's your insurance,
Mm-hmm.
for better or for worse. What kind of insurance you have? We know depending upon the insurance you have will determine the kind of treatment you get.
Yep.
So we could change how when patients come in, if we could be more inclusive and not let insurance be a determining factor into who you see, where you get seen, how often you get seen, and what treatments you get. And I
Mm,
think that will help in improving health disparities. And
mm,
until then, I think we're going to continue to have some of the major issues that we have. If we can take a more critical analysis of the cost of healthcare, and I think, with Obamacare, I think it has done a phenomenal job and given access to people who otherwise wouldn't have access. We
mm-hmm,
just need to do more of
mm-hmm,
that and providing the best care to everyone, providing equitable care to everyone, not just, oh, you have this insurance, you get
mm.
different care compared to other people.